All right, now I'm happy to introduce next Medela's clinical education specialist, Irene Zoppi, who's going to talk about the importance of breast milk and how to initiate a really strong breast milk supply. For you expecting a new mom, this session is going to be full of really great insights to help you meet your breastfeeding goals. So hello and welcome, Irene.
Thank you, Devin. Hi, everyone. What a delight to be with you today. I'm excited to be talking to you about human milk and breastfeeding. I have a lot to share with you, so let's get started. I'm the Senior Manager for Clinical Education at Medela, and I'm a perinatal nurse and a lactation consultant. And I'm chatting to you today from Boston. To the new mothers and mothers-to-be with us today, we have a lot of exciting things to present to you and to talk about. First, let me congratulate you on thinking about breastfeeding your baby. You've made a great decision to provide human milk for your baby. Today, we are going to talk about why making the decision to breastfeed is such a great choice, what to do before the baby arrives, and what specifically you can do in the first hours and days after your baby is born to get off to a great start. So let's get started and begin talking about what's so special about human milk. You might be thinking that providing human milk to your baby is just about providing nutrition, about feeding your baby. But providing food or nutrition is only the start of how powerful your breast milk is to provide a total nutrition to your infant. Did you even know that your body was preparing for lactation really early in your pregnancy? That at 16 weeks, you were making milk for your baby. Providing human milk is about building immune protection, not only during the first months of life, but it offers lifelong protection. Your breastfeeding journey begins by knowing how remarkable your breast milk is. Human milk contains more than 200 known components and some that have yet to be discovered. Breast milk is a living fluid full of some amazing properties. This image is of a drop of human milk under a microscope. It contains living cells and everything your baby's body needs to grow, develop, mature, and survive. A few of these many components stand out as being particularly beneficial that I want to talk about. These components are immunoglobulins, carbohydrates, fats, proteins, and we'll mention water too. Immunoglobulins are antibodies that fight off germs that can cause illness and disease. Your breast milk is like your baby's first vaccine. It contains antibodies that fight off bacteria and viruses. The immune properties of your breast milk can also help protect your baby from the common cold, ear infections, illnesses that cause vomiting and diarrhea, and other infections that can be potentially dangerous for infants. The main antibody in your breast milk is called secretory immunoglobulin A, or IgA. IgA coats your baby's lungs and intestines, sealing them to prevent germs from entering the body and bloodstream. Now more than ever, as we deal with the current pandemic, it's important to provide this special protection for your infant. Carbohydrates are the body's #1 source of energy. The main carbohydrate in your breast milk is the milk sugar known as lactose. Not only is it the major energy source for your baby's growth and development, it is also linked to brain development. Special carbohydrates called oligosaccharides promote healthy bacteria in your baby's intestines and can help fight off diseases like infant diarrhea. Fats also provide a source of energy. Essential fatty acids like arachidonic acid and docosahexaenoic acid, really hard to say, but they're essential fatty acids for babies, and they are like steroids for babies' brains. They help to build better, bigger brains. Research from Brown University has shown that all areas of brain development, both white and gray matter, are increased with human milk diets. The more human milk, the better the outcome. But even providing human milk for 3 to 6 months helps build better brains, so all amounts of breastfeeding are beneficial. Proteins build, strengthen, and repair the body's tissues. They are also needed to make hormones, enzymes, and antibodies. The protein in your breast milk is easy for your baby to digest. One essential protein in breast milk is called lactoferrin, which helps with iron levels in your baby's body. And it too helps protect your baby from infections. So you may have heard that formula is a safe alternative to breastfeeding, and many families think that too. Formula is artificial. Yes, it's an alternative, but the components of human milk are naturally produced. It's the original organic food. Formula is processed canned food. Perhaps looking at this chart helps to sort things out. Take a look at what's in human milk compared to what's in formula. What you can see on the left of what's in formula compares to what's in human milk. It all stops with what's available in human milk. These multi-components of the amazing products of human milk are not in formula. As a matter of fact, the DHA and the AA in formula is artificially produced. It's naturally produced in human milk. What a better way to build a better, bigger brain in your baby than with your own human milk. So what do you want to do before you give birth to prepare for breastfeeding? One word: educate. Educate yourself and the people you live with about your desire to breastfeed your baby. Your family needs to know this is important to you and what you want to do so that they will support you in your journey. Learn as much as you can about breastfeeding. Many of the hospital in-person birth and breastfeeding classes have gone virtual in light of the COVID pandemic. So search out what's available online at your hospital and in your community. Tell your doctor or your nurse midwife too. They can help steer you in getting additional support. When you are admitted to the hospital to have your baby, tell everyone, all the nurses, doctors, and midwives that provide care to you, that you want to hold your infant skin to skin right after delivery and that you want to breastfeed. Every mom who desires to breastfeed should begin her breastfeeding journey in an appropriate manner. Ideally, this means that mom and baby begin breastfeeding within the first hour after birth and have repeated skin-to-skin contact. Research shows what happens in the beginning sets mom and baby up for long-term breastfeeding. We refer to this as a critical time or the golden hour for getting your breastfeeding journey off to the best start. Making milk for your baby is a normal process that all female mammals are able to do. During pregnancy and then after delivery, milk production is based on a complex but somewhat predictable process. During breastfeeding, or during pregnancy rather, hormones stimulate your breast to grow, mature, and begin to make milk. These next few photos not only show how the growing uterus and the growing unborn baby, but if you look closely, they clearly show the breast development that is also occurring. After you give birth, your body will automatically begin a shift in hormone levels. You might be thinking that you'll be pretty tired after giving birth and wonder if starting breastfeeding so soon after delivery is really all that important. There is compelling research that shows for moms to meet their long-term breastfeeding goals, a lot has to happen in the first few days, beginning in the first few hours after birth. The success of building your milk supply depends on activating the milk-secreting cells. The sooner, the better. Activating these cells, milk-making cells, is a one-time event that needs to be started soon after your baby is born. During the first days after giving birth, your baby needs to breastfeed often. Breastfeeding 10 to 12 times in 24 hours is normal. Families may mistake this frequent feeding as not having enough milk for their babies and want to supplement with formula. Remember, your body began making milk for your baby early in your pregnancy. There isn't a lot of colostrum, the rich, thick first milk, but it is present in perfect amounts for your healthy term baby. Baby's small, frequent feeds average around a half an ounce in that first day. Your term baby has stored a lot of fat and glucose during the final weeks of your pregnancy, so small amounts of colostrum is perfect. Remember, frequent feedings are normal. So what happens at that first night that you are home? Well, life turns around. It's all about what I refer to as this 24-hour itis. Your baby is adjusting to being at home, and you are adjusting to being a new mom. In the hospital, you had help. Once you get home, you're on your own, and that can be scary for new parents. It's normal for your little one to want to eat a lot, just like he did in the hospital. So expect to breastfeed every 1.5 to 3 hours. In order to increase milk volumes, your baby's frequent breastfeeding and sucking will stimulate release of hormones that allow this to happen. Around the 4th day after birth, you'll begin to notice your breasts are producing more milk. You'll notice your breasts are more round, more firm. Although many families are familiar with the term, your milk is coming in, you've had milk since early pregnancy. Let's call this milk is increasing in volume. Around 2 weeks, your body will be producing around 18 to 20 ounces a day. That's about 3/4 of a quart or more of milk a day. That significant increase in milk volume shows just how important the time after birth is for milk production. The most important thing for you to do for the first 2 weeks being home is to make milk for your baby. This means eat, sleep, and make milk. Everyone in your family and all your friends get to do everything else. That means cooking, cleaning, laundry, and taking care of other children. You need to have a sense of urgency about milk supply, and paying attention to the rules of eat, sleep, and making milk helps establish an abundant supply. So how do we know your baby is getting enough? Maybe I should have warned you that this slide was coming up if you just had lunch, if you're on the East Coast here. We watch baby's weight gain. We also watch his pees and poops. After day 4, your baby should have a minimum of 4 pees and 4 yellow seedy poops. but probably won't gain back the normal newborn weight loss until around day 10 to 14. So your baby's healthcare provider will be monitoring this with weight checks. You should expect to visit your baby's doctor within a day or two after going home from the hospital. You get to watch his diaper. But don't worry, breastfeeding babies' poops don't smell. Once you've established this large amount of milk, your healthy breastfeeding baby will trigger your body to make more milk. When healthy babies are allowed to eat whenever they want, their mother's bodies will make more milk. No rules of waiting to feed just because your baby fed a little while ago. Feed your baby when he is hungry. Babies have growth spurts. They'll be hungrier or want to eat more often. Just like you, there'll be days when your baby will want to eat a lot more often. These growth spurts happen in the early days, around 1.5 to 2 weeks, around 3 weeks, and again around 6 weeks. Remember, we feed healthy babies when they are hungry, and their mothers' bodies respond by making more milk. We call this the supply and demand of breast milk. The more babies eat, the more milk their mothers' bodies will make. The number one reason families don't meet their personal breastfeeding goals is not having enough milk, whether perceived or actual. In the United States, we know 83% of women initiate some breastfeeding, but soon thereafter, they introduce supplements thinking their bodies are not making enough milk. Yes, there are times when mothers may not be making sufficient milk for their infants. For example, if a mother has had breast surgery or even trauma to her breasts. And we will want to watch those mothers and their babies closely for milk volume issues. Many mothers mistake the frequency of early birth, feeding, post-birth feeding, and episodes of growth spurts as not having enough milk. Perhaps a family member mistakes frequent feedings as not having enough milk and recommends giving a supplement. Maybe something like this happens. Grandmother, your mother, says, "You just fed that baby a little over an hour and a half ago. Your baby is hungry and you're not making enough milk for him. I think he needs a little formula." The new mother may see her older, wiser mother as having experience with raising babies, and so gives her babies a supplement. But does that family member know about normal breastfeeding behavior? Offering a little formula starts down a slippery slope. Mom offers a little formula, her breast isn't emptied, and she starts making less milk. Offering more bottles means making less milk, and over time, the mother's milk supply will decrease. A lot about our lives have changed since the COVID-19 pandemic. Our lives have literally turned upside down. What is clear is that the benefits of breastfeeding and the current evidence of the insignificant role of breast milk in the transmission of other respiratory viruses, as stated by UNICEF, the Academy of Breastfeeding Medicine, the World Health Organization, and the Center for Disease Control and Prevention, is that mothers should breastfeed their infants. But a few hospital practices have changed since the COVID pandemic. Some hospitals are testing all patients as they are admitted. Ask about your hospital's practices. You will probably only be able to have one support person with you, both for your delivery and for the entire hospitalization. And you will be asked to wear a face covering or mask when you are in contact with healthcare personnel, and especially while you are giving birth. Your hospital stay will be shortened, and you will probably be discharged earlier than you had planned. Be sure to ask for breastfeeding assistance from the very competent nursing staff. They're there to help you transition to motherhood and are knowledgeable about breastfeeding. Ask them for a list of community resources should you need additional guidance about breastfeeding when you go home. There's one more important topic to discuss about childbirth, and that is regarding your own health. Earlier, we spoke about a significant change in hormones that take place after your baby is born. These hormones were responsible for growing your breasts and maintaining the pregnancy. Those same hormones are involved in making lots of milk for your baby. But after birth, there is a sudden decrease in some of these hormones that may cause you to experience a period of sadness or a feeling of unhappiness. Many mothers have referred to these feelings as having the baby blues. These feelings of sadness are increased by sleep deprivation mothers often encounter. So here's what you need to do. Take care of yourself as well as your baby. Talk to your partner about what you were going through. Communication is what brought you together, and communication will keep you and your relationship strong. Sleep whenever your baby is sleeping, and try not to be consumed by housework or caring for others. Although these feelings are a normal after effect of childbirth, they're not pleasant. Think PMS times 10. It's important to know the sadness will pass in a few days. What is not normal, though, is not being able to care for yourself or your baby. Speak to your healthcare provider if you were overwhelmed and not able to provide care to yourself or your infant. Yes, hooray! Women's bodies are amazing. Not only can our bodies carry and nourish our unborn infants, they can provide total nutrition for our babies. Think about that. You're a superstar. Celebrate your superstar status.
I love that, Irene. Thank you so much for walking through those basics. I know we've worked at Medela for years. We still learn new things about breastfeeding every single day. So I'm sure that's more than valuable information for some of the moms with us today. So we have got about a half hour where we can open it up to questions here from the audience. I've already seen many of you jumping into the chat with questions for Irene, so we'll dig into some of them. If we miss your questions, don't worry. There are more chances to Irene and the expert throughout today's event and then afterwards too. So we'll definitely get to you. The first question that I have is from Julia, who wants to know, what can I do pre-birth to get my supply ready? And we also had some questions about whether you should pump before you give birth.
Wonderful. Very interesting questions. So your body is prepared to make milk for your baby after you deliver the baby, as well as the afterbirth, or what we refer to as the placenta. Mm-hmm. So there's nothing to do ahead of time to make more milk. Follow the normal guidelines of eating well, healthy diet, and staying healthy. And your body, under normal considerations, normal circumstances, will do exactly what it needs to do, and that is make sufficient milk for your baby. I want you to think about what our great-great-grandmothers did. They relied on their bodies to make milk for their babies. In some instances, those great-great-grandmothers may not have survived their childbirth for whatever reason, and then others may have provided their own breast milk for their neighbors' friends or their own little family friends. That's not what we do here in the United States as a rule. We do see that in other cultures. We call that wet nursing. And in the United States, it's not something necessarily that we condone. We do see it in other cultures. But your body, trust it. It's going to do what it needs to do. So in terms of making more milk for your baby ahead of time, Don't worry. Your body is going to do that, of course, barring any pathology, which your healthcare provider will be monitoring for.
Great. So we got some other questions about how long your body makes colostrum. Diana asked that question. And then if your breasts are leaking while you're pregnant, is that colostrum?
Great question, Diana. Colostrum will last a few days until your milk-making cells take over and produce copious or large amounts of milk. So that colostrum is that thick, wonderfully nutritious product that your body has been producing since about week 16 during your pregnancy. And yes, some mothers do leak while they're pregnant. Many moms don't even know what that means. Both are perfectly normal and mean nothing abnormal is happening. So some moms do, some moms don't. And just cherish what your body is producing. And yes, that's colostrum, but your body will continue to make colostrum until the hormonal shift takes place. And that's going to be at about 3 days, maybe 96 to 72 hours after you give birth. Don't worry about it. Your body's still making that perfect colostrum for your baby right after delivery.
So in that case, do you recommend that moms collect any of that colostrum when they're pregnant, or will they have what they need when they give birth?
So what I can tell you and what research tells us is that your body will continue to make colostrum for your baby after your baby is born. There are some studies that have indicated that for mothers who are at high risk for their babies dropping their blood sugar after delivery, for example, they may have diabetes during their pregnancy or have had diabetes since childhood or in teenagehood. There are some studies that say collect it, freeze it in small quantities for your baby after birth, so that your baby does not, in the case of needing a supplement, need to take anything artificial. However, I would guide you and recommend you talk about this to your healthcare provider, especially the baby's doctor, so that you can get the best guidance of what their recommendation is.
That always ends up being the best advice. Beyond generalities, if you have concerns, speak to your medical team because they know your personal history, right?
Exactly.
All right. Our next question, Nazima wants to know, does your diet affect your milk supply?
Great question, Nazo. So yeah, in a way, your diet can affect the components of human milk, but not to a serious degree. What we understand is that your milk supply will derive from what your body components are. So if you don't have a great diet, your body suffers. Your baby gets everything that it needs. As far as increasing your milk supply, no, it's not going to really do that. There's one thing that increases milk supply, and that is breast emptying. So the more frequent you breastfeed or express your breast milk, the more milk you'll make. So as far as diet, it doesn't really increase milk volume. And a lot of mothers think that, oh, well, I'll just drink lots and lots and lots of water. Well, it doesn't work. What really works is you drink to thirst. As you're thirsty, you replace your fluids. But what really happens is that the more you express milk, the more milk you make. There is an interesting thought about what's in your milk and what's in your diet. Can you increase those wonderful components, those fats, the omega-3 fatty acids in your breast milk, that DHA and that AA in your breast milk? And to some degree, you might be able to. You can't eat, however, 6, God love me, I love chocolate honey dip donuts, haven't eaten one in years, but you can't eat 6 honey dip chocolate donuts and expect the fat in your diet to increase. But there is some theory or thought that if you increase the omega-3 fatty acids in your diet, that those will increase in your breast milk. And these would be from eggs and from certain fish, for example. So no more chocolate honey dip donuts. Well,
every once in a while. We all deserve a chocolate honey dip.
Everything in moderation, absolutely.
And I've also heard that what you eat can actually impact the flavor, more or less, of your breast milk, which I've heard makes breastfed babies less picky eaters later in life than potentially formula-fed babies. Is that true?
You got it. So while babies are growing in the uterus, they're literally drinking their mother's amniotic fluid, or the amniotic fluid that the mother and baby are making together. Mm-hmm. And that's flavored by what mothers eat. So they've long been exposed to what the mother's diet is before they're even born. And yes, what moms eat may in fact flavor their breast milk. So if you have a diet that is high in fiber and lots of naturally occurring fiber in beans and so forth, and in root vegetables, your milk will taste like that, and your milk may take on the appearance of the color of those vegetables. So if you have a diet high in, for example, dark leafy green vegetables or broccoli, your breast milk may actually have a little green hue or tint to it. And yep, your breast milk will take the taste of what you're eating. So if you change your diet all of a sudden, if you're not accustomed to a fruit, plant-based diet or lots of root vegetables, and all of a sudden you eat them, your baby may be a little more gassy as you might be. And if you ate a diet that was very flavored in spices that you weren't used to using, your breast milk will smell and taste exactly like that. And your babies love their mother's own milk.
Interesting. All right, we'll jump into the next question. This one's interesting. If our breast milk has everything a baby needs, why do pediatricians suggest vitamin D supplements?
Yeah, so that's the one vitamin that may be deficient in some babies' diets. So I live here in New England, and in the winter, when moms and babies go outside, if and when they do, babies are covered completely. There's nothing showing in their skin. We get the most vitamin D from the sun, and we have some issues with that in terms of how much vitamin D exposure do I need to be healthy and not healthy. So if you are going out today, it's pretty sunny here right now, I would have sunscreen on. I'm of Irish descent and Polish descent. I have an issue with skin cancers in our family. So I would be covered in sunscreen. That's not a good way to get vitamin D. So for some cultures in the Northeast and in the cold winter climates, even in Alaska, babies are covered up. They're not getting vitamin D. And so they need additional vitamin D. And formula, yeah, they add it, but it's something that we need to make sure our babies are getting. So even dark-skinned babies also need some supplemental vitamin D. And it starts actually within the first month that babies would get that extra vitamin.
That's good to know. All right, our next question from Katie. She wants to know, a friend of mine recommended using nipple shields for breastfeeding pain. What are the pros and cons of nipple shields?
Nipple pain, that sounds awful.
Yeah.
And it is. So if you are experiencing nipple pain, the best advice is to seek professional lactation support. Find out what's causing the pain, because breastfeeding, although there's a tugging sensation that women are not ever exposed to, it shouldn't be painful. So the first recommendation is to get that professional guidance and support. Find out why there's pain, because it shouldn't be painful. There is some research to support if the mother is having if the baby is generating excessive vacuum, which is causing the mom's pain, that breast shields may help, or nipple shields may help. But that's not the guidance I would give every mom who is breastfeeding. I would say get that professional support and guidance and intervention first, so you know what's causing the pain and rectify the pain.
Diagnose the source of the issue, and nipple shields may be a solution for you, but it may be something else that provides you the best relief.
Gotcha. Thanks.
Right. Okay, this one's interesting too. All of your questions are interesting, so I'll keep saying that. But Wesley wants to know, if you test positive for COVID-19, can I still breastfeed my baby, or is my milk not good anymore?
Wesley, there's a lot of information about COVID-19, and a lot that we know and a lot that we don't know. What the recommendations currently are, whether you test positive or are suspected of positive or negative, that human milk provides the best nutrition for infants. And so the recommendation from all of those guiding organizations, whether it's UNICEF, the World Health Organization, the Academy of Breastfeeding Medicine, say that human milk is the best food for babies. So right now, we do not have evidence. In fact, what little evidence we have shows that moms who test positive for COVID-19 do not pass that virus onto their babies by way of their breast milk. Mm-hmm. So let's continue to look at the research, but that's the guidance we currently have.
That's good to know, and probably really comforting for a lot of moms pregnant or breastfeeding. It's been a pretty scary time the last 6 months.
Yeah.
Okay, our next question here from Sigourney wants to know, how often should you pump if you're trying to increase your milk supply?
Sigourney, I would want to know why you think you need to increase your milk supply, I guess. So that would be my first question to you, is why do you think you need to increase your milk supply? But it is a common question that mothers ask. And moms maybe want to have a little extra, I'll call it stash, a little frozen supply left in the freezer for when they might not be with their baby, or should an emergency come up. And so there are ways to increase your milk supply. And the best way is to express more milk. So you either get to breastfeed your baby more often. So if your baby's not feeding to the frequency that you want, you get to pump and express more milk. The more milk you express, the more milk you'll make. So it's a catch-22, if you will. You see your milk volume is going down, your supply is going down, or you perceive it going down because you're not pumping as much. The best thing to do is to express more milk and to store that milk for whenever your baby might need it. And as far as how much milk to express, what we generally recommend in the lactation world for moms is that you want to have at least, if you're going back to work, for example, or being separated from your baby, you want to have enough milk stored for the next day. Don't worry about 3 months from now. Worry about tomorrow, and have that milk available in the refrigerator or in a receptacle that's appropriate for storage of milk, ready for the baby for the next day.
That's so good to know. I think we see all over forums, blogs, Instagram, these freezers packed full of milk. And it's hard not to look at that and think that that must be the ideal, because we know how amazing breast milk is. So of course we would want more of it. But the reality is that you just need enough for your baby to be getting the food they need for the next day.
That's right. Yeah.
All right, the next question is from Meta, who wants to know, is there a way to continue breastfeeding when a baby has a lactose allergy?
So I might want to ask that in a different way. How do you know the baby has a lactose allergy? It's really not that common among newborns to have a lactose allergy. What we see similarly is that families may have a lactose issue. And so families might think that their baby has one as well. So the best advice would be to consult with your baby's healthcare provider to find out if this is a true allergy. Now, we might call it an intolerance rather than an allergy because, as I said, there are really not a whole lot of allergies to mother's own milk. So the best advice is to consult with your healthcare provider.
All right, our next question is, do you need to give your baby drinking water while you're breastfeeding?
So one of the slides talked about immunoglobulins, carbohydrates, fats, and proteins, and way at the bottom was water. And the majority of breast milk, like 80% of it, is really water. Mm-hmm. So your baby doesn't need to drink additional water. Even mothers who live in the tropics don't need to give their babies additional water, just breastfeed, and that breast milk will have enough water for the baby. So even a hot day, I think I heard Death Valley was 130 degrees yesterday. We would all be drinking water, that's for sure. And then, of course, the baby's exposed breast milk would have lots of water in it as well. So just keep breastfeeding.
All right. Our next question in regards to your diet, does caffeine affect breast milk? And if so, how much is safe?
Yeah, so we love our caffeine, don't we? I mean, we get it in not only our morning Java, but we might get it in Coke. We might get it in our teas, Coca-Cola, I should say, our Pepsi-Cola, or in our tea. But just be cognizant of the fact that what 4 cups of coffee might do to you might do to your baby as well. So no need to totally eliminate caffeine from your diet, but think about the amount of caffeine that you're drinking and the hidden choices or food sources of caffeine, and limit the amount of caffeine that you are drinking. And you see what your baby does with that.
Mm-hmm. Okay. Lacey has a good question. You talked in your presentation a little bit about feeding whenever your baby is hungry. Mm-hmm. There's a lot of information out there on different breastfeeding or pumping schedules. So which is better? Which should be the go-to for a standard mom with a breastfeeding nursing baby?
As far as scheduling or feeding?
Scheduling.
Okay, yeah. So newborns should not be on a schedule. We feed healthy babies when they're hungry, and they're going to want to eat a lot. We said 10 to 12 times. We said that first night home, every 1.5 to 3 hours. That's normal breastfeeding behavior till mom's milk volumes increase, which they will do barring any pathology. And we're not going to talk about that right now. But we watch the baby to see what they're doing with the mom's milk supply. If the baby's not having those diapers that we talked about, then there's something else going on. So we'll watch that mom's volume really carefully. You do not want to schedule a newborn baby's feedings. It makes no sense, because if you think about it, here's a little, maybe a little pathology for you. In utero, babies are drinking amniotic fluid whenever they want, little sips every time they want. Their tummies are filled with their amniotic fluid. So why wouldn't that make sense that right after birth, babies want to eat a lot too? They're used to having a little meals, if you will. So scheduling babies right after delivery or newborn periods makes no sense at all. So I'm going to tell you a little story. So if you are a mother of a healthy term baby, and those are the qualifiers here, healthy term baby, and it's 6 weeks post-birth, and your baby slept through the night, guess what? Yay, your baby slept through the night. But we don't expect that from newborns. We want to expect that later as mom's milk volumes increase. So it doesn't equate with normal building supply issues to schedule baby's eatings. You might kind of think about that as your baby gets older, but not newborns. It's really the wrong thing to do.
So watch their feeding cues, and when they show hunger, give them what they're asking for.
That's right.
The baby's the boss for the first few weeks, it sounds like.
Well, maybe a little longer than that, but you're right. Yeah.
All right. Our next question is from Veronica, who wants to know what to do, some basic first steps if you have a blocked milk duct.
Ooh, Veronica, that sounds painful. Oh, I'm sorry that you might be experiencing that. So, for those of you who've never had a blocked milk duct, it's usually a circular round area in one area of the breast that feels hard and is slightly painful. And what you can do is apply some warmth to that area and massage that area either before or before breastfeeding and or pumping. It should resolve rather quickly. It's a temporary situation, but it's painful.
Yeah. Okay, our next question is from Rachel. She wants to know if you have any tips, pro tips, or pitfalls to avoid for second-time moms who are coming through this for the second, third time with their babies.
Oh, what a luxury to have another child in your life. And I would say those first 2 weeks, you get to sleep as much as you can. Have everybody, just gather them from the woodwork, neighbors, family, friends. I know it's COVID, you probably can't do that, but get everybody you can to let you sleep and feed your baby. The first couple of weeks are hard. Your older child is used to being the only one in the family, and that's tough. That's hard. So you need to give separate time for that baby as well. It might be a baby that's still nursing or a toddler that's still nursing. And how do you separate that from the newborn that needs his mom's milk? So in that recommendation, you would feed the newborn first. And then if the toddler wants to still breastfeed his tandem nursing, then you would feed that baby. It's not easy. Parenting has many, many challenges. I wish every mother and new family had a network of others in the house to take care of the older children, so the new mom can be with her baby and sleep, because sleep is just so necessary.
And we hear a lot from second time or veteran moms that their second experience ended up nothing like their first experience in either direction, that their first may have been very difficult and they had an easy time the second time around, or vice versa.
Yeah. So just if you have had an experienced breastfeeding situation, know that this new baby may be totally different. Nothing necessarily will tell you that you're going to have as the same experience, because they're new babies. They're different babies. They may have different oral facial anomalies, or their anatomy, it might be different, and their character and their personalities might be different as well.
So that's a good segue into another question, and we've got 5 minutes left, so we'll probably only get to a couple more for now. But Amanda wants to know, is there any way to teach my baby to open her mouth wider for a good latch?
Great, Amanda. Thank you for that question. That's a toughie, right? I mean, how do you get your baby to open its mouth wider? There are some techniques. You can stroke the baby's area below their upper lip. This area right in here, the philtrum, might help open. But in the beginning, the stars and the moon have to be in a line to get that baby to be opening its mouth to approach the mom's nipple in the right way. And that's a bit of a challenge in the beginning. And sometimes mom's anatomy may not accommodate that tiny, small mouth. So we're going to just work with that. Moms may, out of necessity, need to extract their milk, express their milk, i.e. with a pump, until their baby grows, because they're a tiny baby. But I would suggest, if you're having issues with the baby not being able to open its mouth, to seek lactation support. and that they'll be able to give you the best advice for your particular situation.
All right, this next question, and then we might have time for one more. I'll try to squeeze in as many as we can here. Should babies be woken up to nurse, or should we let them sleep as long as they want to?
Don't we all love to sleep as adults anyway?
Especially new parents.
And maybe not so much babies. So, yeah. So if you have a newborn and your baby is not healthy or term, you may need to wake your baby up to feed. You do not necessarily want to let your baby sleep as long as they want to. If your baby is less than term, let's say 37 weeks, you can't let them sleep. You got to wake them up, because those babies are on the edge. They're like a little bit not quite term and not really premature, but they're in that cusp area. And those babies are what we call fakers. And they really give us a run for our money. And those babies need to be woken up. So if your baby is term and healthy, and it's how many days post-delivery? If it's 2 to 3 weeks, let's just revel in that, knowing that the baby slept. But do they sleep through the night, or do they sleep in periods? So it might be, for example, that they slept from 11 at night to 4 in the morning. That for them might be a nighttime sleep. It all depends on babies, but for healthy term babies, it's not so much a big a problem. It's those little tiny ones that just aren't quite term that we worry about. So there's a lot of guidance there if your baby is in fact not term.
All right, and our last question for this session, and like I said, Irene will be back later for more questions, so keep them coming. Roxana wants to know, do you recommend pumping in the first week after childbirth?
Pumping in the first week after childbirth. I would ask, why do you want to pump? Is your baby not breastfeeding, direct breastfeeding? Is your baby compromised in any way? Is your baby in the intensive care unit? Is your baby separated from you? With healthy term babies, it's kind of like, let them figure it out. Let them determine or produce the amount of milk that their bodies will need. Let them go on to produce the copious milk supply. And maybe later start pumping rather. Wait till your milk supply is well established. And that's generally after a month, about 4 weeks, 4 to 6 weeks. So it depends on why you're pumping as to what I would recommend. Again, if babies are not breastfeeding well at the breast, that's a different story. But if your baby's doing great at the breast, just marvel in that and wait until that baby produces its own milk supply, or builds and maintains that mom's milk supply, generally about 4 to 6 weeks.
All right. Thank you again, Irene. That's all we have time for now. But like I said, Irene will be back in about an hour with myself and Khadijah Adams, a new mom and breastfeeding advocate, to talk about more of the most common breastfeeding questions we get. So a lot more to come. And thank you again, Irene, for giving us your expertise.
All right. See you later, guys.